Remember, dementia is associated with many comorbidities. Higher rates of falls, delirium, weight loss, frailties. One of the biggest problems is oral health. People get dry mouths from the medication. They have poor oral hygiene because they forget, or they have dyspraxia in using a toothbrush. 5 or 10% of people will get epileptic fits as part of their dementia. People can have visual problems. They get a visual agnosia. Their vision might be okay, but they can't process what they see. So a woman says, look, I tell him to take the milk out of the fridge, and he can't do it. He doesn't do it. But 5 minutes later, he'll get up and do it himself. And that's idiomotor dyspraxia. He can't process the information to then carry out the action. But a different part of the brain where he does it spontaneously. I've mentioned sleep disorders. There's a breakdown of sleep architecture. And there's a whole other talk I could give about behavioural and psychological symptoms of dementia, things like aggression, calling out, which are really difficult issues, screaming. They're difficult issues to manage. There are lots of different medications. They don't work all that well. They have high rates of stroke, particularly antipsychotics, and death. Higher rate of not high rate of death, but an increased rate of death. About a 1% increased mortality in people on antipsychotics. And there's a big move now to reduce use of antipsychotics. A survey of nursing homes showed that 28% of residents in nursing homes are on antipsychotics. Higher rate are on antidepressants, which may be appropriate, but sometimes overtreated. See, GPs can't win. 10 years ago, we said people with depression are being undertreated with antidepressants. And now there's a worry that they may be overtreated. Citalopram, there have been a couple of studies showing it improved agitation and delusions and hallucinations. And it's a safer option than antipsychotics. Sometimes cholinesterase inhibitors can improve hallucinations. And memantine can also improve them.